World Health Organization says our continent, Africa, urgently needs more COVID-19 vaccine supplies as deliveries are beginning to slow down. The first batches are nearly exhausted in some countries. Less than 2% of the 690 million COVID-19 vaccine doses administered around the world have been in Africa. Most countries only received their first vaccines 5 weeks ago, and just in small quantities. Professor Tumbi Ndungu, Deputy Director of the Africa Health Research Institute, joins us now. Professor, good evening. I mean, we need a lot more doses. We need them really quickly. I imagine it's a really urgent need to get them as quickly as we possibly can.
Yeah, thank you very much, Stephen, for having me, and good evening to the viewers. Yes, we do need the vaccines. Traditionally, vaccines have been the most effective public health tool to fight against any infectious disease, and it's not going to be any different for COVID-19. Unfortunately, in Africa, because of access issues as well as distribution issues, we are not at the stage where we should be.
There's several issues here. I mean, one of them is around just the vaccine doses. We've seen the UK and the US, they've vaccinated large numbers, large percentages of the people in those countries, life almost returning to normal in some parts of the United States. I would like to think that that manufacturing capacity will now result in Africa getting more doses.
One hopes so, Stephen, but it doesn't seem like that's going to be the case. Obviously, we are having a lot of difficulties with access, with vaccine nationalism, as a lot of global leaders, including our own president, have mentioned before, where these countries that are resource rich, that are able to manufacture these vaccines, have secured the doses that are needed, and in some cases they are stockpiling some of these doses and not sharing them with the low and middle-income countries. So I think the problem of access to these vaccines is going to be a big problem. It is estimated that by the end of this year, a very small percentage of people in Africa, for example, will be vaccinated. So I think the problem of access to the vaccines and the problem of intellectual property for these vaccines is something that we have to grapple with for a long time to come, as well as the distribution, because we don't have very good distribution capabilities. In the short term, I think those are the problems. I think in the long term, what we must do is to develop our own capacity to develop vaccines and other life-saving medications here in sub-Saharan Africa, for example.
There have been some suggestions that we actually need at least 5 vaccine-producing centers, so 5 factories on a regional basis, in other words, in different regions of our continent. Do you think that's right? One of them won't do it, not just 2 or 3. We actually probably need around 5 producing vaccines on a regional basis?
I think so. I think that's about correct. We need centers for vaccine production throughout the continent. The problem, I think, is with the intellectual property. And I think one needs to also realize that even when we talk about vaccine manufacturing, it's not just an easy process where you wake up one day and can start manufacturing these vaccines. Usually it takes years and years to get to actually develop the technology that is needed to develop the vaccines and then to be able to rapidly deploy it. That's why you see, for example, the success with the making of the COVID vaccine with the mRNA vaccines that companies like Pfizer are now developing. So I think in Africa, what we need, in addition to developing the manufacturing capabilities for these vaccines, is also to enhance our research and development of vaccines so that we can begin to own the actual intellectual property for making vaccines, and so that when we have the next pandemic, and for sure we will have the next pandemic, then we can be better prepared to make our own vaccines and have our own intellectual property and not have to depend on other countries to share their intellectual property for the making of these vaccines.
The United States has said it will support a waiver of intellectual property at the World Trade Organization for COVID-19 vaccines. Is that going to make a big difference? I mean, there was a lot of excitement at the time of that announcement, but nothing really seems to be happening through there. Since then, it's quite a long process.
Yeah, I don't know what the backroom negotiations are that are going on in order to share the intellectual property and to make it freely accessible to many countries. But I think that even sharing the intellectual property by itself is actually not enough because, as I said, we don't have some of the facilities that will be needed, for example, to manufacture some of these vaccines. And I think that tells you that it's not just a question of the sharing of the intellectual property, it's also having the local manufacturing capability, which I think most African countries lack. I think countries like South Africa would have the capability to make these vaccines if the intellectual property rights for some of these vaccines could be waived. But generally speaking, I think we have a long way to go in Africa in terms of developing our capability for making vaccines. And I think, Stephen, if I may, I also wanted to just mention that it is not just COVID-19 vaccines, actually, that we are struggling with access to. COVID-19 has disrupted our access to other vaccines for other vaccine-preventable diseases. And this is going to be a problem unless we can get around this problem as quickly as possible.
There's also, of course, then distribution. You touched on it. But just in our region, for example, I mean, Namibia, Botswana, relatively small populations. Zimbabwe, a much bigger population. We have a big population. Mozambique, I would imagine it'll be some time before people, say, in Cabo Delgado, where we have an insurgency, actually get the vaccine. I mean, distribution and getting injections into arms could be a major problem.
Yeah, so these are the two major problems. One is the access issue, getting access to these vaccines, and that's, as we have mentioned, the ability to manufacture is not always there, and the countries that have the capability to do that are not always willing to share and to make accessible these vaccines. But the second problem that is a major one is the logistical challenge of distributing these vaccines to far-flung places. Remember that most of these vaccines need cold chain refrigeration. So it's the logistical challenges of distribution of vaccines itself is not easy. So we need public-private partnerships to be able to make sure that vaccines can get to as far-flung places as possible, and for us to develop the infrastructure that is needed for the distribution of these vaccines in these remote areas. Not an easy challenge. Certainly it can be done if there is much more global collaboration and partnerships, but certainly not easy.
Professor Thumbi Ndungu, always appreciate the time. Thank you, Deputy Director at the Africa Health Research Institute.